Uscom BP+, Understanding Cardiovascular Disease. Cardiovascular disease is the leading global cause of death. Peripheral blood pressure has been the basis of clinical practice for over 100 years. However, the blood pressure increases as it gets further from the heart due to the increasing peripheral resistance of the small arteries. The degree to which the peripheral blood pressure is higher than the central blood pressure is neither linear nor predictable, due partly to the varying compliance of the arteries. Central blood pressure is the pressure that affects the internal organs. Peripheral and central blood pressure may differ by up to 40 millimeters of mercury and respond differently to medication. What does the evidence say? Central pulse pressure is more strongly related to cardiovascular disease. Central and peripheral blood pressure respond differently to medication. Overall, less medication is needed when central blood pressure is used to determine treatment. BP Plus has been validated in adults against invasive catheters. The Uscom BP Plus measures central blood pressure with a familiar upper arm cuff which comes in a range of different sizes. A measurement is performed in less than a minute with the press of a button. The brachial blood pressure is measured as the cuff is inflated. By inflating to a suprasystolic pressure, central blood pressure is accurately measured. The speed of measurement makes it ideal for use on children. It is recommended that the patient is at rest for at least 5 minutes before the first measurement. Ensure the patient is sitting comfortably upright with legs uncrossed. Apply the deflated cuff to the patient's left upper arm, unless contraindicated. Choose a cuff of the correct size, as indicated by the range markings on the cuff. The artery marker on the cuff should be placed over the brachial artery. The cuff should be wrapped around the arm firmly, but not tightly. Avoid placing the cuff over thick clothing or bunching up clothing above the cuff, which may partially occlude the artery. Support the subject's forearm on a stable, horizontal surface with the cuff at the approximate level of the subject's heart and held away from the subject's torso. Generally, a palm-down position is more comfortable. Check that the inflation target is suitable for the patient. To save measurements, ensure the SD card is inserted. Instruct the patient to relax, remain still, breathe normally, and cease talking during measurement. Press the start button. The device will then begin inflating the cuff. During this time, the status area will display measuring blood pressure, then measuring pulse wave during the suprasystolic measurement. At the end of the measurement, check the status message and rhythm strip. If the rhythm strip shows artifacts, repeat the measurement after checking patient and equipment. Repeat to ensure 2 consistent measurements. The parameters displayed on the Uscom BP Plus screen include peripheral systolic and diastolic blood pressure, central systolic and diastolic blood pressure, and pulse rate. The rhythm strip can indicate arrhythmias. The shape of the pulse pressure wave is related to the stiffness of the arteries and provides a visual indication of the vascular resistance. Suprasystolic technology. BP Plus holds the cuff 30 millimeters of mercury above the measured systolic pressure. BP Plus uses a direct physiology-based algorithm to model the pressure wave transmission. A pressure pulse enters the subclavian brachial artery where it is reflected at the point where the cuff occludes the artery. The pressure pulse travels back towards the aorta and is reflected back down the subclavian and brachial arteries. The suprasystolic pressure wave recorded from the cuff is the sum of these forward and reflected waves. The improved energy transfer of the BP plus suprasystolic method increases the sensitivity and accuracy of the measurement used to determine central systolic and diastolic blood pressure and other parameters in less than 60 seconds. The Uscom BP Plus is revolutionising central blood pressure measurement using non-invasive suprasystolic technology. It is quick and simple to use, raising the standard of care for your patients. Uscom. Devices the experts use.